I mean, the mental health needs are off the charts. That's the biggest challenge, is the mental health needs of our building. If it weren't for the connection that Ms. Myers gave us with Family Innovations, we would have no mental health support here whatsoever. But that Family Innovations partnership has been huge in servicing our kids.
And Family Innovations is a private mental health clinic system. We provide outpatient therapy and counseling services for infants, toddlers, preschoolers, up through the elderly. Our premise is really based on, we want to engage families and parents in the mental health care of their child, and not just make this a site-based model in the school, but to really involve the parents in their community.
We were super excited to come into the school, but we had a lot of questions. So I had two worries. One was that we'd have so many referrals that I couldn't keep up with them to start, and the other was that we'd have all these staff so excited to be here and no referrals coming in. But we found out the people that needed to be excited about it, like the 3 social workers, the social work team, the behavioral interventionists, the administration, they were so on board and just talking about, getting together as a group, saying what kids do we need to get services in first for, and the referrals really started pouring in.
When we see the therapists here working with the kids, it's as if they have a magic dust that they're just sprinkling on the kids. And honest to God, it's amazing watching them work and having our kids go. They see that adult in the building, and it's their life coach, it's just their advocate, and the kids will do anything for them. They will do anything for those guys. And one quick example I can give you where I saw the magic dust was, we had 2 really aggressive kids, and they were going after each other. And I separated the one who was instigating. Told the other kid, come here. I said, you can't put your hands on him, but you can say whatever you want to say to him. And he looked at him and he said, I just want you to stop. So I put them back at the table together. They were finishing eating, and the instigator picked up his milk and threw it out. And I said, you're done. We're taking you back to class. The instigator's therapist was in there talking to the teacher. And it was, no lie, within 25 seconds of him sitting down, the therapist went over, whispered to him. The boy walked over and gave the most heartfelt apology. And that's where I said it was like he sprinkled magic dust on it, but he built in this relationship with them, and he talked him through the situation, and he was over there working on an apology, and where I was able to step out, and it was done. And that was actually the exact effect that I wanted Family Innovations to have. I know they have the proactive piece of doing therapy sessions and that, but in crisis, when we need them in that situation, we don't want to send the kids home. There needs to be restitution and fixing and learning, and it happened with him right there on the spot.
I was just talking to one of our staff today, and I was asking about a kid, because I was like, when we first were here, he was in the hallway all the time, not in class. There were always behavioral staff with him, and he always said, I have energy bugs, I have to get them out. And I honestly haven't seen him in the hallway for a long time. So I was like, his mom recently got out of jail, and I was unsure if he was still going to be going to school here. I kind of thought maybe he had transferred already. And my staff said, no, he's still here. And he's like, and he's doing really well. So he's staying in class, he's learning. It's just really exciting.
Started with a phone call from Judy Myers. From there, met with Scott and talked through with him, what are you seeing, what are you needing? Judy was a part of that meeting. From there, we had a couple of meetings with social workers and other support staff here. And that was just really fun to walk Scott Masini and his staff through the process of what our model looked like, because they had never heard of a model that had 6 full-time master's trained counselors available to any one school. Then we had to go through the contracting process with the district offices. So we had several meetings with the assistant superintendents. I had to kind of sort through how would this work from a model that would be sustainable and fiscally sustainable. which is one I think of the strengths of this model, is that we're not using any grant funding to support the mental health services that are being delivered to students in the classroom, hallways, cafeteria, or more importantly in the students' homes along with families. The negotiation process was not difficult. We actually used the site-based user agreement contract that we have with another school district, changed it to fit the model here at Bruce Vento and for the St. Paul schools, and used that as our kind of template for a contract with the schools.
When the district got involved with this, they said, yep, we're doing it. We want to make this a model for the district. So we need to do it right here so we can duplicate this all over the district, and it's starting to be duplicated in other schools. I remember exactly a year ago, we had hit rock bottom here. We're in such a different place right now. There's just so many more systems set up, so much more support for our kids.